Hello, it's a pleasure to be with you. My name is Dr. Steve Parry. I'm going to share some of how we got the HowFit plan, the home wellbeing and fitness plan going last year as the pandemic progressed. So why HowFit? I've had a long-standing interest in exercise and preventive approaches. My work is predominantly in geriatrics and acute internal medicine, and I've applied those kind of principles to falls services here in the Northeast. Added to that, there's been a horrific, and it was very apparent very early on, deconditioning, weight gain progressed at pace, and those health inequalities associated with obesity and physical activity became ever more pertinent as the pandemic progressed. Coupled with that was the thought that we may be able to circumvent some of the usual processes that can perhaps not obstruct progress in the NHS, but delay it a little bit further down the line. My other guise is as clinical director for older people with North Tyneside and Newcastle Gateshead, CCGs, and with the huge support of senior colleagues in the CCGs, HowFit was born. So what is it? As I said before, it's exercise for those who don't, or those who haven't done exercise for some time, really any sedentary person. It's not aimed particularly at older people, though this tends to fall into the category of those who fit the HowFit plan. There's also a dearth of resources for those who are very unfit. Many of the people I see day to day in my acute medicine service and in my clinics, those people who just don't think that exercise is for them. Exercise is for gyms, it's for runners, it's for cyclists, it's for bodybuilders, but not for them. And a lot of the stuff that's out there assumes a level of fitness that is possible, that is irrelevant to so many in this target group. And there's little in terms of progression even in programs where less fitness is assumed in the target audience. So it's a static set of exercises. So I wanted to devise a program, co-design it with stakeholders, test it out and get it going. So we contacted a personal trainer who had huge experience with older people, working with Age UK in strength and balance training classes as well, has as his own gym and fitness business, Phil Earley at ITS Business. The exercises Phil devised were then co-checked with Skye and Heidi, senior NHS physios, and they are in 3 levels, from chair-based to just about managing wall or floor push-ups, squats, that kind of thing. So in those 3 levels. We wanted to signpost to additional resources, and it was very purposeful that this was to be a leaflet with an eye-catching design, an accompanying website with custom animations and videos alongside the descriptors of the exercises, all done by a private company, Jump. Rob Brown, the CEO, has done an extraordinary job with this. And then we had a widespread consultation through health, social care, third sector partners, leisure sector partners, the mental health services, all had a hand in reviewing the leaflet and ensuring it was fit for purpose for the target groups. And then again, in a very deliberate move, rather than targeting smaller areas, there's been a leaflet drop in Manchester to something like 70,000 older individuals. So that was quite difficult, I gather. We decided to go large and to deliver to every household in the boroughs of North Tyneside, Newcastle and Gateshead, largely to make sure we didn't perpetuate those health inequalities that are so troublesome, and also to make sure that digital poverty didn't play a part in how we got HowFit out there. This is the leaflet designed to be appealing. The The language is very straightforward, and the HowFit plan is based around mobility, stability, balance and coordination, strength and cardiovascular fitness. So those are the different categories that our exercises fall into. And I don't want to read this in any detail, but just to give you an idea of the breadth of those involved, numerous in the third sector, everyone from Age UK through Rise, Health Watch, Connected Voice in Newcastle, the Falcons Foundation, the rugby team, the North Tyneside Community Healthcare Foundation, our local mental health trust for the North East Ambulance Service, you name it. There was a huge effort to not only involve people in the creation of the leaflet, but also to ensure that it was promoted. We further engaged with the local authorities to get schools to look at the HowFit plan, numerous patient groups and charities related to patient disease problems, universities locally, crucially putting HowFit into all care homes in Newcastle, Gateshead, North Tyneside, and into pharmacies and opticians. Has it helped anyone? And when you put out something as blanket as this, it can be incredibly difficult. As anybody who's been involved with a leaflet kind of program will tell you, it's very difficult to see what's going on the ground. We have numerous case studies. These are a couple of examples. 83-year-old lady who hadn't been upstairs in 5 years, uses Zimmer frame downstairs. 4 months later, with the HowFit plan, she's up and downstairs and walking with a stick independently outside. An 88-year-old lady wrote to me, her and her friend, who hadn't been outside since before the onset of the pandemic. By 3 months of the HowFit plan, out and about, walking independently, and have dispensed with their home carers. But is there anything a little bit harder than that? Have we got something a bit more definitive? Certainly the social media that was managed by Rob at Jump, the Facebook page reach, 35,000 odd pages, at times of the pages we've seen. The website data through Google, we've had 33,800 page views. And of the Google registered users, the majority are female, but interestingly, only 294 of them were over 60. So this just illustrates how widespread the potential for this plan is in terms of targeting those who are not fit, but able to do a little bit of exercise. A lot referred on from social media. 2,927 of those were referred direct, and locally we've tried to address further the issues of digital poverty with Age UK locally having schemes to loan out equipment like laptops and tablets in order to try and get people online and using the web page. So what next for HowFit? Well, we are about to embark on a regional rollout to the whole of our ICS footprint, and Jackie Park and the next team are responsible for helping sort this out. We have local champions to identify partner organisations, key individuals to promote this in all the CCG areas in the ICS, that's North East and North Cumbria. And it's critical that we don't restrict this to the frail elderly, all sedentary individuals. Important that we link with regional prevention and obesity prevention work, public health engagement, waiting list fitness group that we're working with currently in the ICS to try and keep people fit as they sit on the ever expanding waiting lists that we're troubled with. We're furthering the comms strategy. We've engaged a learning disabilities acting group and another acting group called Operating Theatre to create short films and webinars that will be housed on the associated YouTube channel. We are employing trainers for all care homes in the North ICP, Newcastle, Gateshead, North Tyneside and Northumberland, in order to promote HowFit in all care homes, including learning disability. And in a pilot that we've just completed, we had a 32% reduction in falls in that home taking this approach. We're expanding into an app that Rob and Jump are helping us with, and there's a further ongoing evaluation. And what of evaluation? There's a lot that we are in the progress of doing. Random sample of initial households that they have a plan was sent to, stakeholder questionnaire, engagement with Healthwatch and Age UK, who are conducting their own surveys. Hard outcomes are incredibly difficult for this. And for instance, fall and fracture rates, which are a natural home for this kind of activity, are extraordinarily difficult to disentangle from the background noise of the pandemic, people not getting hip and knee surgery, etc. But that's not stopping us looking at it, and particularly in comparison with nearest neighbor CCGs. Ongoing web analytics, targeting depending on those analytics, and we have a research program in order to evaluate specific components, including the falls in care homes, and we're partnering with the AHSN on this locally.
Hi, my name's Leslie Young-Murphy. I'm the Exec Director, Nursing Chief Operating Officer at North Tyneside CCG. I first got involved in HowFit by working with the team who've been instrumental in its development. We were busy working on some other developments at the time, an innovative approach to using technology to support people improve their strength and balance, when we saw an opportunity to look differently at that and think about how we could use the same concept in paper form to support the health and well-being and fitness levels across the population. The COVID pandemic provided us the platform and the opportunity to do that, and it seemed appropriate to try and think about how we could maximise some of the resources that we'd already developed.
Hi, my name's Earley from Signature Fitness. I've been in the health and fitness industry now for over 20 years, which has seen me attend courses in the likes of the US, Italy and Hungary. I've known Dr. Steve Parry now for at least 15 years and have worked with him in the past on other projects. Most recently approached me to do some exercise programming for a cutting edge program called HowFit. What we've done here is introduced an interactive way of getting people to take action on their own health and fitness. I've used what we call a health pick and mix approach so that people can choose a level that's appropriate to them. We've adapted strength, balance, coordination and cardiovascular exercises on three different levels, so that they can choose, for instance, a level 1 mobility or a level 3 strength or cardiovascular exercise. This ensures that nobody will feel left out or that they feel behind somebody else. In addition to this, we now have cutting edge animations and videos, which allows people to feel even more involved. And we know already from the feedback we've received that the leaflets are producing great results. On a personal level, my own mother, who's 84 years old, uses the exercises and is very proud to say that she can still touch her toes without bending her knees. Evidence if you need it.
Hello, my name's Heidi. I'm a physiotherapist, and I've been working with Dr. Steve Parry and Phil Earley, the exercise trainer, since 2010. Steve had his amazing idea last April, and he brought it to me and Phil, and we got our heads together and developed the exercise program over the course of the summer. By September, the leaflets have gone out to the local area, and we were delighted when patients within a very short order started to come to clinic with the leaflets or tell us in clinic that they'd had them through the door and had begun to follow the exercise program. So as far as we're concerned, we were able to see that the leaflets have been a success, and I'm very pleased that they're going to go out to a wider range geographically.
Hello, my name is Skye. I'm one of the physiotherapists who works at the North Tyneside Falls Prevention Service. I've worked here for the past year alongside Steve Parry and Heidi, and I know Phil through working through the HowFit project. Now, when Steve first came to me with the HowFit project, I got very excited because that is very much my area of expertise, working with older people in the community and trying to have an impact in their lives when they're not at clinic. So I was very excited to jump on board. My role was to work with Phil and Heidi to produce some exercises for a range of abilities. Now, Phil and Heidi have a background of working in the private sector, so I made sure the exercises were for an NHS audience and a range of abilities, as well as doing the videos at home following social distance measures with my models.
I'm Rob Brown from Jump. My team and I have been working with Steve and his team since April last year. Steve came to us with this idea of offering a batch of exercises to individuals so they could do these exercises at home during lockdown and beyond. We basically took the idea that Steve had, along with the exercises that Phil and Heidi pulled together, and we created a 24-page leaflet which was distributed to many homes within North Tyneside, Newcastle and Gateshead. We also created a website, howfittoday.co.uk, which also allowed an audience to watch the animations and videos online. The leaflet and the website were both built in isolation, so we have an audience who uses the leaflet and we have an audience who uses the website. Both have been successful, and we're just about to launch another distribution of leaflets to another part of the northeast of England, so we hope that it continues to be a huge success.
So, what messages can we pass on through HowFit, and how we manage to get it done? The speed of approval of the idea and its funding were critical, and the recognition by our senior decision makers, as I brought to them the clinical need, was rapid and intense. It was very quick. We managed to get it rapidly through a lot of NHS processes, and I have to say that the absence of long proposals, which we're all guilty in the NHS, was phenomenal. The private sector engagement without extensive procurement was also incredibly important in trying to get this off the ground. The physical trainer, the leaflet graphics and website design, printing and delivery organization. By way of comparison, the NHS sources that we looked at to do this initially were going to take 8 to 10 months in the pandemic and with other work that they had on. So doing it our way, we managed to do it in 3 from start to finish, including delivery. The use of social media was really important, and we learned some lessons along the way. Instagram, Snapchat, not interested. These are young people's platforms, and they just weren't bothered. The website and Facebook, much more successful, and we've targeted along the way and will still be doing so. But alongside those cutting through the chaff kind of efforts, there's got to be checks and balances. The project was approved with internal scrutiny from the 2 different CCG's executive boards. We had, as I showed you, extensive stakeholder involvement and scrutiny, extensive patient involvement, and that was so important in getting things right and getting the right tenor to the leaflet. Our personal trainer was well known to us, long association with Age UK and a proven track record, and that NHS physio review and further contributions from our physio colleagues made sure that this was utterly fit for purpose. The Jump design and web resource team do a lot of work locally with NHS partners, and comparison was sought with NHS services and other private providers for delivery charges to make sure that we were getting value for money. But the potential for HowFit is potentially quite large. If you look at the web analytics from that first 317,000 leaflets dropped in the Northeast, around 10% showed an interest in exercise via Google and separately via Facebook. 1.4 million it's going out to at the moment. If that 10% held true, and there are some assumptions there, you will understand that, that may not necessarily be as following on as they may be. However, those kind of numbers, that's the potential for 140,000 to have additional interest in exercise who may not have previously. And if we did this nationwide, you're talking about near on 750,000 people who may get some benefit from this. The blanket approach to the leaflet drop was really incredibly purposeful to ensure that nobody was disadvantaged by this, that it wasn't specifically targeted at one group or another, and that we didn't exclude, as so many things do now, those who are unable to access the internet. Having said that, targeting may be helpful. So for instance, diabetes and other disease grouping in long-term conditions, the older, frailer population, also pre and mild frailty, waiting list patients we're in the process of targeting already, and enhanced targeting for the younger sedentary. And of course, throughout all of that is the challenge of visibility, sustainability, and meaningful evaluation. So I hope that's helped get you an overview of HowFit. I hope that the Q&A will provide us with some interesting discussion. Thank you.